Hi, I'm Dr. Eric Westman, and this is the Keto Made Simple podcast.
So I had a few questions sent in, but otherwise, I think at the beginning, I'm just going to give a heads up on what new things that I've learned. I spoke at a meeting on mental health over the weekend. It was a very interesting conference, so I'll give an update on that. It was called the Functional Medicine for Mental Health, and I'd like to give some detail about that. It was a great meeting. And then I had a nibble, and I'm taking the nibble, or they put in the bait and I nibbled on it to give a talk next summer up at a major medical institution in Chicago, which is kind of great. You know, these medical meetings, grand rounds, usually are booked, a year or so in advance. So that's a good sign that there's some activity in the academic world to learn more about keto diets. In fact, the way the world works is I know one of the people who is on the speakers panel to find speakers. So I recognized one of the names on the invitation. So I'm afraid it's probably a medical only event in the Chicagoland area. Looks like it'll be downtown, but that's next July, I think. So planning that far in advance. I hope everyone is doing well, and I'm getting more and more feedback in my clinic about the videos I'm doing at the YouTube channel. It's actually kind of eerie to have me do a video a couple weeks ago. I kind of remembered saying those things, and someone comes in and goes, "Yeah, you said blah blah." Wait, when did I say that? And then the people come in saying, "I feel like I know you already. You're on TV," and I calmly explained that I'm not on TV. I'm on your TV, but it's YouTube. It's not networked. Anyway, my straw poll: most people do not have cable TV anymore in our area, even in my demographic. I think I might be the last one to pay a cable bill, and most people are either streaming or just spending their day watching YouTube, which is a fascinating change from 5 years ago, right? Of course, if you've been following the YouTube channel and then other YouTubers like Eric Berg or Ken Berry, they may be changing the algorithm to put things that don't correspond with the World Health Organization's view lower on the algorithm. So they can claim it's not censorship, but it's just putting you lower priority. And Eric Berg did a YouTube on that, and it's a double-edged sword, right? You start aligning with certain organizations and assume that they have no vested interest and bias. I'm afraid all organizations do, including the World Health Organization, which is ostensibly above the fray, but they're beholden to lobbying and a certain point of view as well. So anyway, that has to be the most watched video at the YouTube channel ever, even only because it's been out a couple of weeks, just because of the massive following that Dr. Berg has. And I'll probably do another one just to clarify that I don't agree entirely with what Dr. Eric Berg says. Some people were saying, "Oh, I'm so glad you endorse him and go along with everything." No, I don't go along with everything he says, but we're certainly on the same keto sort of wavelength. So anyway, so the clinic's changing, clinic population. In fact, leading up to this conference that I spoke to by Zoom on last Saturday, October 7th, this last couple of weeks, I've had people come to me for mental health problems. And I don't advertise. I've never advertised the clinic. It's word of mouth, and people just look up at Duke now to see the keto clinic. But the father brought in a child who had their first psychiatric outbreak, Mental illness can be in many different forms, depression, anxiety, and also hallucinations. And this young man, ended up as a lot of schizophrenic or schizophrenic form that he didn't know exactly what to call it. But he, thought the world, was doomed, and he wanted to kill himself. So he read the scripture so that if he suffered on this earth, he would have a place of glory in heaven. And that feels so close when you have mental illness that you would actually act on that. So he got through that episode, and they were searching for, they read Chris Palmer's book on brain energy, which has a role for a keto diet in there to increase brain energy. And Chris wrote a case series with one of my patients about schizophrenia reversal. So that was interesting. I'm also seeing some patients for binge eating disorder, which this is thought to be the total opposite of what you're supposed to do in the dogma. Of course, the dogmatic treatment of binge eating has been dismally ineffective. So, having something like this where you're excluding the foods that you binge on actually seems reasonable to me. And if I explain it to people and follow them up, it actually seems pretty reasonable. So while I was preparing slides for this meeting on Saturday, I got a text from Dr. Shivani Sethi, who has set up the metabolic psychiatry unit at Stanford. And she came through my clinic some years ago, and she texted me showing this beautiful home. Well, it turns out it was a mansion in Geneva, Switzerland. There's a conference going on there now where she's giving the keynote address on keto and psychiatry. That's kind of the international psychiatric meeting, keto getting up there. The one I spoke at, if you want to follow along, if you go to psychiatryredefined.org, that's the website. The whole URL is psychiatryredefined.org, Functional Medicine for Mental Health Conference 2023. I just Googled the functional. So I Googled FMMH 2023, and the splash screen came up, Functional Medicine for Mental Health, October 7 to 8, an online conference. And so when I gave a talk, one of the first ones, the conference was put on by Dr. Greenblatt, whom I had never met until recently at a BOCA meeting for the Society of Metabolic Health Practitioners. And he said he had known of my work for a while, and he had treated many, many children, pediatric and young adults, with keto diets for psychiatric problems, including binge eating and other issues. So it was really nice to see the follow-up meeting him there, that he asked me to talk at his meeting. He trains psychiatrists in the functional in an integrative psychiatry fellowship. I don't know a whole lot about the fellowship, but this is part of that training program. So on Saturday, October 7, I'm looking at the day one agenda. The title is The Impact of Ketogenic and Low-Carb Diets on Mental Health. And so I led off the morning basically summarizing the data that we had collected over the last 20 years. And then, of course, talking about the hunter-gatherer, paleo-primal history before that. But that doesn't count if you're only starting the clock with randomized trials and clinical research, modern day evidence. But there's quite a bit of evidence now for the safety. And I'm trying to say over and over, and would like to hone down the quick statement that everyone goes into nutritional ketosis after 3 days of not eating. Think about that. Everyone goes into nutritional ketosis after 3 days of not eating. That's what we have stored on our body. And so then the corollary is everyone goes into nutritional ketosis after 3 days of not eating carbs. So it's kind of a natural thing to do, to burn fat. And so I tried to lay the groundwork for the day of just taking away any fear that people might have about ketosis. And although I don't have data on mental health, sometimes I find my role is just to reassure people, if they're new to the area, that they shouldn't be afraid of things that I was afraid of 20 years ago. I worked people through those hangups. The next talk by Dr. Terry Walls, I had never heard Dr. Walls speak. You may have heard her name. It's the Walls Protocol, popularized as a treatment for multiple sclerosis. So I had never heard her speak, and I know she's a physician in Iowa, and her story is that she was in a wheelchair from multiple sclerosis, and she did some research, and one component of her approach is a low-carb keto type of diet, and that she got this popularity, a book written, and I'm waiting for the second patient. I just want the second patient. I know she had this phenomenal result, but there's always this possibility that she's a rare genetic consistency that would only work in her, or that the placebo effect is so strong, but that shouldn't fix MS. But she actually has published a couple studies, but they're very small, and her intent of continuing the studies is kind of thwarted by the fact that she's not a researcher, and she consulted people. The good advice she got is that she should publish her case as a case study, and she did. And the bad advice she got is that she should continue to use everything in her protocol that she used to improve herself. So basically, she's created a protocol that's very difficult to stick to. And so you're getting into the idea that you have to do those 20 different things. It's hard for other people to stay on those 20 different things, but what is the most important thing? And of course, bing, 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 to me, I think it's ketosis. I think the keto element's probably the most important, because a year ago, I've heard signals about MS getting better in some people, but a year ago at a ADAPT meeting in Atlanta, there was a young woman who her MS went away, and I asked her to start a Facebook group, kind of on the model of how do you bring together the grassroots folks. Type 1 Grit did that with now thousands of people using a keto diet for type 1 diabetes, and we actually surveyed their membership and published a paper in the Journal of Pediatrics about that. So this woman actually started a Facebook group last year, and now there are hundreds of people joining in this Facebook group called Keto MS. And so I'm finding that that's sort of my strategy now, to, if someone gives a credible anecdote, but the disease is tough. And so MS is it comes and goes. And so, what you did might have nothing to do with this remitting and kind of disease. So get people together in a Facebook group, it costs nothing, and she knew how to do it. She's, under 30 years old. I think people are born now with the ability to be on social media. Anyway, so I guess my point is, even after hearing Dr. Walls and hearing the story and the slow progress of the research, I think she may be handcuffed or shackled a little bit by the advice that she's been given, that she has to study the protocol that she did, that includes all these other things. Who knows if they help or not? So I'm blessed with the research background, having gone through clinical trial research, to kind of examine and re-examine and try to tease out what's the most important factor of all these different things. And I'm afraid that she hasn't had that kind of background or consulting to tease that out. So in the Q&A, she gives a great talk and talks about the history of human, the kind of classic modern illnesses as a result of modern nutrition. But in the Q&A, I asked her directly if she measured ketones. So, if the Walls protocol is a bunch of different things and it's a low-carb diet, what's the most important thing? I wondered if she was measuring ketones. And she is. She says she's always between 1 and 2. So that's the beta-hydroxybutyrate, Keto Mojo or Precision Extra machine, the beta BHB, beta-hydroxybutyrate, between 1 and 2. So she keeps herself in ketosis. Fascinating. And I'm still kind of holding out that maybe maybe it's just the ketosis that's helping the MS. And then I was a little disappointed that the science hadn't progressed. It's been, I think, 7 years since the paper she published that no one really has validated. So again, I'm waiting for the second person to have resolution, or there was some snippets of some improvements she showed in videotapes. But so there is a signal there, no question, that for multiple sclerosis that things may be able to be improved, but the clinical experience is way ahead of clinical trials. It's in that sort of category of I'll teach someone how to do it with this disease, but I won't guarantee that it's going to work. If someone has diabetes, metabolic syndrome, obesity, I'll teach them how to do it, and I'll basically guarantee it's going to work if you stick to it. And I'll help you stick to it, to work out the details. The next paper or lecture was done by a fellow in the UK, Professor Campbell, a young professor who has bipolar himself. And, this is kind of another recurring theme, is that a lot of people come to this because they do it themselves, right? So that's the classic weight loss doctor, Dr. Tro Kalayjian, Dr. Ken Berry. They had a whole lot of weight to lose, so they went to the keto diet and they lost weight themselves and now are teaching it to other people. Well, Professor Campbell is a young man, had bad bipolar disorder. So meaning, the mood going up and down like this. So when you're up, you might even be manic, where you're on a spending spree, you have no money, but you run up your debt, your credit cards, or you have an affair when you never would have done that before. So mania can be quite disruptive, but then you get mood swings in bipolar disorder where you may have terrible depression, where you might just you lose your job and you can't. So that bipolar means you have these ups and downs that are really, really disruptive. Most people have ups and downs of their mood and emotions like this, and we bounce back. And bipolar is just more extremes. So he found out with his own experience, and this is the first time I've ever seen a graphical display of someone's ketone level and their symptom of mental health. So he graphed his own, his own perceived mental illness, anxiety, and depressive symptoms. And as his ketone levels went up, these symptoms went down, pretty reliably. And he's a researcher himself, a PhD, and very interesting to see the other research going on at Stanford. Dr. Shabani Sethi has a couple pilot studies going on, including for mental health, like bipolar, also binge eating. And there's now a benefactor, a philanthropist in the Bazuki group. If you go to Bazuki, so it's Bazuki. If you search Bazuki, David Bazuki, in fact, if you go, I think the better place would be to go to YouTube and type in, I hope you're following along, type in David Bazuki, Bazuki. Oh, no, that's not the right one. Oh, shoot. I'm trying to find the YouTube of him fixing his schizophrenia. Okay, it's called Metabolic Mind, Bazuki Family and Neuroscientists on Keto and Metabolic Psychiatry. So there's several videos about his experience, and it's their son, Matthew. So Jan and David are the parents, sons. Here's another sort of story of how grassroots change. You have a child with the illness, and the child does the keto diet based on the parents' urging, and he gets better, like severely affected, and now it recovers from this mental illness. Now, if you're fortunate enough to have a lot of money and you're a philanthropist minded, like the Bazukis are, they've started a organization now to fund education and research on psychiatry and keto diets or metabolic diets. And so it's really interesting to watch one of these videos about Matthew Bazuki and his transformation. Again, these are anecdotes that get amplified and grow either based on an individual. That's the PhD in the UK, his own experience. Now he's studying it. Or here, it's parents of a son with the severe mental illness. I'm actually kind of reminded of the old movie Lorenzo's Oil. Remember that, where the parents had a child with a terrible genetic issue, and they went to the library. I mean, it was quite dramatic TV or a movie where they basically figured out that giving a certain oil would help with this problem that their child had. And the type 1 grit with David Dykman is another story of David and his wife with a child with type 1 diabetes trying to find the best work. And they approached Dr. Bernstein, who has type 1 diabetes, and he's in his late 80s, and helped bring out education from Dr. Bernstein. So getting back to the meeting, I learned that this group is now funding people, including Dr. Brett Scher. Dr. Brett Scher gave a talk at the meeting. You might recognize his name, Scher. He used to be the metabolic director or the physician lead with Diet Doctor. So he was sort of the, Andreas Eenfeldt is in Sweden, and he teamed up with Brett giving the interviews for years, and he really is become an excellent interviewer. But as Diet Doctor has shifted away, or it seems like they're going more towards satiety, not talking keto so much. Brett, I don't know if that's the reason, but Brett has switched over to do work for the Bazuki group and the metabolic mind, the psychiatry use of a keto diet for psychiatry, which is very interesting. Brett's talk was more than just psychiatry here, and certainly he's a cardiologist. I remember meeting him years ago, and as a cardiologist, he started talking about the lipids, and he's starting to understand that it's more complicated than just the LDL, and so I think he's going to be very helpful to the Bazuki group to have a grounding in the keto world and with Diet Doctor, and to help now a group that I don't know how much money they have, but they're going to be funding a lot of research, is the word on the street. The next talk was by Georgia E. And I see some chatting going on here. It's chat room. Dr. Brett Scher has talks interviews as well for this group. Great. Yeah. Psychiatry. Oh, thanks for putting that in there. And then low-carb MD. So, right, I'm not a podcast listener. I maybe I need to develop this because Tro, I love Tro and Brian, and the low-carb MD episode 265 is with Matt and Jan Bazuki. Come on, I don't think it has to do it. And actually, I should be writing more and putting more information out than listening, taking in. But there has to be a balance of that, no question. Great. So, a couple of good marks from the. Any idea how much funding they have? Did he wrestle that information out of the Bazukis? Okay, no idea. Okay, well, and he has to be a pretty good interviewer to really nail that down directly, right? Or you might get the angle of how many clinical trials are being funded, that sort of thing. The next talk was by Georgia Eid, and Georgia is a psychiatrist who found a doctor in Toulouse, France, who had put patients on his psychiatric ward and put them on a keto diet. And sometimes it's a small world. I met a clinical person in Hong Kong and then LA, and it turns out Oliver, who's in Hong Kong, is the cousin or related to the doctor in Toulouse, who was putting people on the keto diet for severe mental illness. So Georgia found out about this doctor and is a clinical guy, no research background. And so Georgia came to me and said, what can we do? How can we help this guy? So Albert was the doctor who had charts, the old style paper charts. And so we helped him put those charts into Excel spreadsheets. I taught them how to do that and had them do it twice to make sure the data were correct. And so we got it into good enough shape, and Georgia and her group wrote the paper up and went back and forth through the peer review process and published this paper on the use of a keto diet for inpatients. And most people got better. Not everyone did it. Some people were severely ill. But what was fascinating is Dr. Danon's practice. He knew these people. He knew the patients, and he knew these people were refractory to the typical treatment. So he basically offered this as another sort of treatment, and the results were really pretty impressive. So that, I've worked in a residential program in Durham, North Carolina, not for psychiatry, but for diabetes and metabolic problems and for obesity. I really don't know of any inpatient ward that uses a keto diet for mental health and for psychiatric problems. We have these clinical wards are all over the place, and there's one very close to Duke here, the State Mental Institution, but they don't do anything about diet. It wouldn't be such a hard study to do, to just take charge of a subset of folks' diets, and there's certainly a lot of people in these institutions. You do need special IRB approval to be doing research with people who are institutionalized, but it's not impossible to do. But hopefully the Bazooki group will do some inpatient work as well. And the Albert Danon's set of people, 28 inpatients, it's not solid enough for me to say, here, look, it's going to work. And it's in that realm of it's interesting pilot data that, because he selected people, you could always have some unconscious bias that he selected people that were going to be better or had had potential for rehab. I don't know. But so anyway, that's fascinating. It needs to be repeated, ideally with some sort of control group. Although in this case, having known the doctor doing it, and I've never met Dr. Danon, but I've talked to him and communicated with him by email. It's not made up, but it could be that it needs to be repeated in other people's hands as well. There may have been some charisma, I don't know. You never know. But so that's pretty neat that it was actually Georgia Eade who got wind of this doctor in France, and we collaborated and got that paper together, which is really just a clinical series, and yet I think will be very helpful in advancing the idea that there's a signal here, and it needs to be taken to a greater level of scientific scrutiny. And in the first paper I wrote with our case study, Doris, who's schizophrenic, voices went away after 8 days of changing the diet. This was my first experience with someone with schizophrenia getting better. I didn't know she really had that disease. I was treating her for weight loss, and I looked at the chart when she said, my voices are gone. I was like, but what do you mean voices? Took me by surprise that she had a host of other problems, but that her voices went away, and it was a durable, long-term resolution of that problem. Unfortunately, Doris passed during COVID. The bad situation is she had no money. She was part of the teaching clinic that I am part of, and had no family really to take care of her, and so last I heard from her, she had moved to be close to family, and then she had passed this a year ago from COVID. She had other illnesses, but she had lost 200 pounds, kept it off, and no longer had those voices. There was a PhD candidate in town who kind of took Doris under her wing and created a audio documentary because Jen was in a course at Duke on documentaries, and I think I can track back somewhere on my computer. Jen put together the audio version of Doris, which recreating voices. It was fascinating, kind of, and telling her life history, which is just really terrible, about being raped when she was 8, to family, and anyway, just having the urge to kill her baby. That's how bad the schizophrenia was, and anyway, so that was my contribution to pushing forward the mental health avenue, that side, and the meeting with Chris Palmer and then Shivani coming through Duke. I'm glad to see this. I think what I'm able to do is just bring forward the practical reality that yes, people can do this, and you don't have to worry about it being harmful. That even though this is not a disease that I'm really treating frequently. That the patient who came in recently, first schizophrenic outbreak, has not come back. So it's like within the first month, so I don't know how he's doing. Then back to the meeting, this is just last Saturday, then Dr. Rob Lustig got up and I chatted back on the chat room privately. It's a good thing that this wasn't available years ago, because, I probably would have chatted with people as we were watching the Zoom, these individual chats, the private things, But I'm chatting with Rob on the side because I hadn't talked to him for a long time, and he's doing well. He's retired from clinical practice and loves it, but he's writing books, and he's trying to figure out how to sue the food industry so that they stop making the garbage. And I really have to give him credit. He went back and got a degree in public policy, so that he could have a credential to try to get that moving forward. But he's not in the clinic anymore. And the talk he gave was food, metabolism, and psychiatric disease. And kind of a typical Rob, he just does too much. And then he always has to come up with something about fructose. Fructose. That's his classic video that went viral, was sugar, the bitter truth, but it was fructose. Yeah, and I was on Capitol Hill once lobbying for the Atkins company years ago with Rob, and I swear he kept saying fructose, and the poor staffer's eyes were glazing over. I said, Rob, say sugar, then they'll understand you. Say sugar. By the end of the day, it was like the 8th. Have you ever done that kind of lobbying thing? They run you around one room to the next, and you never see the senator or the congressman. You see the staffer, and they're taking notes, and so you can't make that person your child's age understand. You're not going to get through to the congressman. So by the end of the day, Rob said sugar. It took me really kind of being kind of a little thorn in his side all day, because we pile in the van, and I look at Rob, you didn't say sugar, you said fructose. But it is fructose. It's in the liver. It's self-fructose. Like, yeah, but no one knows what it is. And the other thing is, it doesn't occur naturally in nature, fructose. It's always with glucose. So that's called sucrose. So sucrose is glucose and fructose. Now, of course, I gave my talk, and guess what Rob's question was? Is it the fructose? Is it just that you're lowering the fructose? Is that why the keto diet works? And I had to say, it could be, but I didn't have the gall to say, well, if you're thinking it's fructose, you have to prove it. I don't have to prove it. I just use something that does a lot of things. So anyway, it was fun to banter back and forth. And I have to say, I really handed to Dr. Greenblatt. I didn't know I guess, I met him just last fall, I think, in Boca, or must have been winter. That's the Society of Metabolic Health Practitioners is in Boca, usually the end of January. And I hope to be there again this year. But I really, that was just great. I hadn't seen Terry Walls speak, and then Professor Campbell doing a pilot study using his own ketone measures was fascinating. And they're starting to do research now, growing that in his group in the UK. So pretty cool. And it is a lot easier to just talk right here on Zoom than to travel somewhere. But as I mentioned, but I met Dr. Greenblatt as we were going to get coffee at the Boca meeting. So the downside is I didn't get to have coffee with Georgia or that's usually you learn a lot, or you get to chat and with people in the off time at a meeting, or maybe I just need to get better on my meeting personal chats with other people, more aggressive, the private chats. Kathy says, I just booked my flight to Boca tonight. Oh, great. Yeah. I'm planning on being there. It's here on this side of the country. And well, that was kind of the update I wanted to give on the meetings I've been to, and kind of a shift in the clinic, the people watching my YouTube videos. And fortunately, most people get positive feedback. Of course, the unsolicited speaker who said, you got to get rid of your ums. That was pretty interesting. And then there's one person who put in there that she thought I had a mole that my dermatologist better look at because it was growing. Anyway, I'm not on TV. It's just on your TV. It's called YouTube. Or maybe I should let people think that I'm just on TV. But it does concern me that, looping back to Dr. Berg's concern, that now the filtering is starting to happen, right? So no one's asked me to be on PBS, NPR. I don't tick the boxes of political correctness, or of course you have to merge with clean eating and all. And no, you don't. But anyway, the censorship or lowering, the point being, if you search keto diet today, and you might do that, although no, you can't, because your browser has probably been fashioned by what you've been searching before. So you have to kind of go to a fresh browser, fresh computer, I'm pretty sure, and then just search keto diet, and the first thing that comes up is anti-keto, even though the Dr. Berg has a gajillion videos and they're all whiteboards and they're legitimate education. The sad reality is that people may get rebuffed because it's not the most popular video anymore. It's the one that's sanctioned by the World Health Organization. So, and then then we're getting back to sort of it's not YouTube anymore. It's filtered through people who think you're good enough to be on TV, or you have a product to sell or something. Oh, Jana, thank you. A regular, well, I was supportive. I don't know about the brilliant, but I'm definitely supportive. And that's kind of interesting. If you've never seen me in the clinic one-on-one, sometimes people are taken aback. Recently, someone said, I've never had a doctor talk to me that long. Meaning me, of course. No one's ever talked to me. Well, I didn't mention, the patient after you is canceled. So I was able to work in more time. I just gave the impression that it just happens all the time, right? But the support is crucial. And of all the things I've learned recently, the one that bubbles up is Dr. Vera Tarman and the addiction world, having it's required that you be in a group if you're going to address an addiction. I mean, it's not optional. And that's often the missing factor for people who do keto on their own, or low carb, whatever version they try it. There's no one there to support them. They're dealing with it really an addictive element. And so, yeah, support is a big part of what I do. I even have pom-poms, remember? Although for those of you who are way back in the ALA, I used to do songs, and then we got squelched because the copyright infringement, I guess, was an issue. So can't do the songs here. But let's see. Let me get to some questions. Oh, and then there was a question about switching, adding back carbs. So, and this is a really important issue for everyone, really. Let's say you're at your goal or you're near your goal and you want to add back carbs or be more flexible. So the real thing is just to do it very slowly. And it could be excruciatingly slowly, meaning, 5 carbs a day for a few weeks. So, that's a quarter cup of berries. That's it. To add for a day. Okay. So you're not adding back so many carbs that you're going to get a volume, a salt change. You're not going to hold on to that extra salt, which is weight. And I do think that for most of us, we're carrying around less fluid than before, which is a good thing. I mean, you're not as puffy in the fingers or in the legs. But so if you're adding back carbs, wanting to maintain, you watch the waistline, how you feel, the cravings, the weight, and the cravings come back. That was, I think, the real point of the question, can come back with a vengeance. And so again, to just do it slowly, thinking not if I have a quarter cup of berries, I'll have the whole quart of berries. It's just a quarter cup for the day. And if you've learned that there's a trigger food, like, nuts, it's going to be a lifelong thing. I had a nutless August because I have nuts around and I don't put them in Ziploc bags, and I have free access to the tubs, and, just like some of you might. So if there's a trigger food that you've learned about, you just have to be very careful to stay away from those things. I think Amy, who wrote most of End Your Carb Confusion, did a pretty good job in how to transition, although we didn't really do an exhaustive job of how to transition. The New Atkins for a New You, which is another book that I am an author on, going back to 2010, had a little more in-depth and more detail on how to transition. And so that might be something to check out if it's kind of the informal adding back a little bit, okay, do it slower, less frequently, and just it isn't working. I remember because they had a ghostwriter help us, Olivia Beale, who had written a lot for Atkins in the past, and it went into great detail about adding back carbs and transitioning. And of course, I don't want you to use net carbs. That is brought up in the New Atkins book, A New Atkins for a New You. But the discussion about cravings and bringing back carbs is a good one in that book, as I recall. Let's see. Comment. John, thanks. I found doing the ALA courses, books, YouTubes, and ALA Hub have been very supportive. Oh, fantastic. Let's say Janet says, what's happening in the body to cause a craving? Well, I don't think anyone knows the exact mechanism. And I think whoever asked the question said it wasn't the blood glucose, or at least it wasn't detectable by blood glucose rise. And it could be the simple effects of the food on the nucleus accumbens, which is a dopamine release of any drug of abuse. And sweetness gives you a little dopamine hit as well. But a craving, I don't think it's been really fully described biochemically, but it is kind of a universal phenomenon, right? If you start eating fruit again, you'll start craving fruit, and you might even crave other carbs where you haven't had them a while. And then I use that saying, which ask me if I crave fruit. When someone's saying, I never give up fruit, I'll say, ask me. But no, ask me, and I force them to say, do you crave fruit? And I say, no, I don't eat fruit. They usually, oh. And then I'll say, do you crave cigarettes? And, no, I don't smoke. Right. So I crave Five Guys burgers because I just had one over lunch, So you're going to crave Oh, maybe it was the peanuts. So I see. Okay, Janet, it was you. Fantastic. I don't think anyone really knows what causes that. And it, not a whole lot of recent science on the blood sugar as a cause for craving. And if you think about it, the blood sugar is going to be pretty how should I say, non-specific. So whatever you eat, if it raises the blood glucose, that doesn't tell you that it was the banana that raised the glucose. So there's got to be, for a craving, there's got to be something tied to the look, the feel, the taste. Just by chance, I used to work with an inventor genius who was the inventor of the nicotine patch. And we did studies with people who were smoking. And if we infused nicotine in the vein, they didn't get the same effects that they got when they smoked a cigarette, which, might be duh. Well, see, if you infuse glucose in the vein, you're not going to get the same effect as eating a banana. For the pleasure, we call these secondary cues, the smoking of the hand to mouth, the inhalation, the flavors, all those things are linked. They're paired. They're called conditioned cues to the effect of nicotine. So I think this happens with different foods as well, so that your body knows that it was a banana you had. It wasn't just that the blood glucose went up. Does that help you understand that? Because it's going to be more complicated than just the glucose elevation. Let's see. Barbara says, just a thanks for pushing keto in those early days before this wave of new docs. Well, yeah, I had no choice. I've been learning since 2016. So glad to hear you have a ton of new docs who help change the wave of illness. I was at a conference over the weekend. I met Dr. Hampton and Dr. Berry, and who worked with Dr. Trove. Fantastic. And well, my pleasure. But now the new generation. Why don't you go to your browser and go to YouTube and type in Nick Norwitz, Nick space Norwitz. Nick has a YouTube site, very dramatic. Nick is a medical student at Harvard, but he's already a PhD from Oxford, and he is just super smart. He just took his one of his exams, USMLEs, this weekend. But watch his video. I pulled it up in the clinic recently because he basically fixed his own ulcerative colitis. Again, the model here is there's a doctor with a problem. They come on to keto, they fix themselves, and then they learn about it. And now he's already been on, I don't know, a dozen research papers. His brain runs on a faster CPU than me. And there was a medical student who came through my clinic who was running 3 computers with YouTube at double speed. This is where I learned that I could go through a YouTube video and learn by just speeding it up. He was doing 3 at a time, kind of learning anyway. So some brains can bring in all that information that fast. But Nick's journey, he was seriously ill with this terribly devastating disease called ulcerative colitis, where you can have diarrhea that's bloody and painful. And so he found a keto diet, and he also loves food. So I would urge you to follow Nick and just be aware that he's out there. He lives in Boston because he's a Harvard medical student, but he's an upcoming guy to watch out for. And is pretty modest for being such a smart guy. And so I asked him, that was a pretty fancy video. Did you do that?
Is one of the most powerful tools we have.
And he said no. He had a friend who did it for him, but it was someone he had helped reverse whatever medical problem they had. So just kind of interesting themes of how, I got in this because 2 of my patients did this in front of me, and I just was curious and thought this would be easy to fix obesity if people could do it on their own. And so naively 20 4 years ago now, yeah, I thought we'd do a couple studies and obesity would be gone because we'd show that it was safe and well, it's more complicated than that, I'm afraid. So anyway, Nick Norwitz is another, so he's kind of the new generation of doctors, although Tro, I think you could say, is new generation too, Dr. Tro Kalayjian. And I think that I get to, let's see, Ann, hi Ann. Dr. Westman, will you provide some of the info regarding the medical professionals or studies you referred to tonight? Okay, so they're all at that website. Are you able to get to the FMMH 2023 website? Yeah, I'm afraid I don't. I mean, I would just Google, I guess it's Georgia Eid, it's Brett Scher, Rob Lustig, and then the PhD it's in the chat room way at the top, right? Yeah, the psychiatryredefined.org, and the fellow who's studying bipolar in the UK. I don't think that meeting had, I think, 300 people involved, and they were, I think, all part of that training that Dr. Greenblatt is doing. So I don't think it's going to be out there for everyone, although I may be wrong. Yeah, you might be able to get access to it at the website. Any questions on your mind tonight? Well, Dr. Laura, yeah, Pam, thanks, Pam. Well, Dr. Laura Buchanan, another new generation doctor. She just had a baby. Laura and her husband, Matt Calkins, are just out of training down the street here in North Carolina, and they've been wearing continuous glucose monitors themselves for years. And so, can you imagine that you go into a doctor and you say, I think my blood sugar goes down when blank, and they'll go, yeah, of course, because they've noticed it on themselves for years. So that's going to be interesting to see. At their hospital, actually, the workers get the CGM, the continuous glucose monitor, for free. For those with diabetes, it can be very helpful to bring down the insulin while you're doing a low-carb diet. In fact, Mark Cucuzella did a study where he just handed out the continuous glucose monitors to people, didn't tell them what to eat, but people automatically started reducing the carbs because they saw their blood sugars going down. That feedback is strong enough for a lot of people. So Laura's great. And they just had a keto baby, which, yes, you can not eat carbs and go through pregnancy. And although if I'm talking to someone, I'm pretty clear that there are no clinical trials about this, but it makes sense physiologically, and there are a lot of people that have done it, but that doesn't mean it's going to be totally safe. So I always hedge on that, whether most people want to just kind of be told, yeah, it's probably okay. Great. Well, thanks, John. Thanks for no questions or hello, Anne. Yep. Let's see. You can unmute.
Thanks. Hi. I found tonight really interesting because I've lots of tidbits I can search and look on, but you talked about Ozempic in one of your videos, and some people may need something, some may not, but I was at a meeting of a group called Diabetes Sisters, and there are a lot of type 1s, type 2s, so it's a mix, but one of our members is a PhD in cellular and molecular biology. She's type 1. She attended some sort of symposium on metabolism, and there were quite a few endocrinologists there. A lot of people with type 1 diabetes also. And when she told us the conversation she had, I didn't say a word, I just listened, but she said that every endocrinologist she spoke with was in favor of trying to get their patients to get, whether it was Ozempic, Wegovy, all of them. And she was saying, everybody has to ask their doctors for these. This is your right to go in and request them. And in my head, I'm hearing what you had said in the video. And, if you have binging issues, this will take care of it. In my head, I'm going, try keto. It got rid of my binging and compulsive eating. But to hear that at this huge scientific gathering, all the endocrinologists she spoke with and heard speak are really pushing these medications. And at the same time, no one was talking about making lifestyle changes. So it wasn't a lifetime commitment to being stuck on these medications and having to deal with the side effects, which some people said, oh, yes, you need to get used to those. It's just part of taking it. And I'm thinking, so...
Do you want to be on the tilt-a-whirl diet, really, where you're feeling nauseated? So my friend in town, Dr. Wickham Simons, he's in his own private practice. He's not in the insurance setting, not at Duke. He has 10 to 15 people on those medicines every day. And his nurse practitioner has a prescription for 100 Zofran, which is an anti-nausea pill. So they're just handing out pills for the nausea. So yeah, take that medicine and just take this pill for the nausea. So treat the side effects of the medicine with the medicine, and well, no question it can help. And the endos, like most medical doctors, I'm an internist by training, and then so to be an endocrinologist, you're an internist, then you become an endocrinologist. It's a subspecialty of that. We've trained a generation of doctors to use medicine. And that's it. So they don't know about lifestyle. They don't care about lifestyle. And in fact, if you're in a practice where you don't have much time with people, it's quicker to just write a prescription or two. Here's one for the medicine. Here's one for the side effect of the medicine. And then you don't even have to give them a list of foods and teach them and talk to them when they say, I can't have bread. Because well, the problem with the Ozempic and the Wegovy and Saxenda, it's all very similar, in Mounjaro. So it tricks your body and brain to thinking that you already ate. And so it takes 2 or 3 months for most people to get that feeling of fullness so that they eat less. And then, another, 6 months into it, you're just not hungry. But think about what happens after a big meal. When you're sending these signals to your brain after a big Thanksgiving meal, what do you want to do? Nothing. You don't want to have fun. You don't want to go out and play. You want to sleep after Thanksgiving dinner. So a lot of these folks now they don't want to have fun. They're thinking that at least they're losing weight, but they're struggling to do it. And then, like you're saying, okay, let's say you're at your goal. What then? Where have we ever seen a very rich woman do a program called OptiFast? She lost all this weight and no one told her what to. She gained all her weight back. And then she's on the next Oprah, basically. The last thing is you want Oprah to do your program because she'll do it a while and then she won't do it. And then all the way So once even weight loss surgery, even Ozempic, all these, at the end, you have to teach people how to eat. And you are very strong in biting your tongue, but most doctors have no clue at anything. But now even the medical weight loss doctors, I have to say, are onto these medicines because they're easier to prescribe. They are very effective, and most doctors who even do weight loss aren't worried about the long term like I am. I was taught by very responsible obesity medicine doctors who said, you want to teach people how to do this for a lifetime, not just for the 100 pounds. And they come back 10 years later, they regained 100 pounds, and you're going to have to give them another. So teach them how to handle the environment of food that you're in, and you taught people how to keep it off forever. The marketing of pharma right now with these drugs, it's there's a glut of interest. So there's a hard to get the drug. And so what you were hearing was two things. One is to get the supply up. Patients need to be advocating for it. And then also to get it paid for by insurance, you need to complain. So patients complaining will get insurance to cover it. So now half the time, if someone comes to me and they really insist on getting the medicine, I'll say, sure, but first we have to check to see if your insurance covers it. Half the time, it doesn't cover it yet. So it's $1,000 a month. Now, well, I can't afford that. I'll just try the keto diet then. Well, so I usually give the whole spiel of we can use diets, we can use medicine, we can use very low-calorie diets, we can use surgery. And it's kind of a stepwise approach. why don't you start with diet? We'll see how you do. Come on back. We'll talk about it. And then, if I can teach people really well with our simple method, it usually sticks, and I don't have to go to the next drug level. Although phentermine still works pretty well. If you're really struggling, even in this program, although, if you're super strict, and you might have to be super strict for the whole month to avoid those cravings coming back, it will work for just about everyone. But I do have a small fraction of folks who are using medicines in addition, just because for whatever, life circumstance, they're just unable to be super strict to this kind of program. So I hope that came through. I'm not against these. It's just, it shouldn't be first line, or it shouldn't be the only thing. And I echo I don't know what to do with endocrinologists. I mean, they don't listen to their patients when the blood sugars are plummeting like this. So, don't worry about it. Just eat more carbs. Like, no, get off those medicines. So we have a very different philosophy. And so my philosophy is that of an obesity medicine doctor, not a traditional endocrinologist. We reverse type 2 diabetes and metabolic syndrome and obesity. We don't just manage it with medications. And you have a fantastic endo who supports keto. Well, fantastic. Well, I'm sure, and you charismatically taught the person without he or she even knowing what was happening. Or she, Oprah, Ozempic offers no empowerment. Well, there are a lot of people who just, the locus of control of health, they want other people to fix you, fix them. And empowerment happens when you just keep the carbs down. And talk to an endo, and all they do is talk about the TSH. Yeah. Well, talk to Amy Berger about that one. She'll get riled up on that. And did you notice the Stall Slayer is going to be opening? And so if you haven't taken it or want to take it again, well, if you bought it once, you'll have access to all of that. It's a great course to do as well. And then upcoming, we refilmed the KMS class that's in the works. Mike and Mary Dan Eads did a protein course for us, and we're working hard on getting Nadir Ali, who's a cardiologist in Houston, who has some great teaching videos, to do a course on cholesterol. So for the Afterlife Academy, that would up our game from me doing the review of cholesterol to a cardiologist who really he gets into the weeds, but I think you need to really disentangle this kind of religion about cholesterol, that the old paradigm is the total and LDL. The new paradigm is triglyceride and HDL, in short. So I still kind of want to do a book of the quarter or something, not book of the month. Maybe we'll get to that one day. And all the books. So I got Metabolical by Rob Lustig, and I can't get. It's just too detailed. Don't think that would be a great one to do. If you wanted a very practical book, The Dietitian's Dilemma. Has anyone read Dietitian's Dilemma? It's Michelle Hearn, who is a young dietitian who fixed herself by doing the exact opposite of what she was taught. Kathy, this is a great book. Yeah, great. Well, so you got either Dietitian's Dilemma, or if you wanted to get into the insulin resistance, Ben Bickman's book, I think, is a little more approachable, but even then it's still pretty physiological. And, could we even start with articles or even videos? Yeah, well, that's true. It wouldn't be quite as much. Well, let me think about it. I have both those books, or even, some classics that I get something new each time I read them, is the Gary Taubes, Good Calories, Bad Calories, or Nina Teichel's The Big Fat Surprise. And so if you're new to the whole keto area, this gives you the background of why it was, the science really wasn't strong for low fat diets, and where the low fat diet came from. For me, it was very important to know that we really weren't like turning over hard science. It was really weak science. And so at times when it conflicts like this, it's good to know that where the low-fat diet came from was not hard science. But those are rather long books and articles or even videos. Okay, well, Pam, maybe you could suggest one. Not a, you know, it's pick one right now, but, or I can just talk about the last meeting I talked at. It sounds like several of you liked the talk tonight, which for me was easy to prepare, and you didn't have to do any reading either ahead of time. Awesome. Really, some of the old, yeah, good. Well, I hope you're all doing well, and we're on the verge of opening another class, the sugar and ultra-processed food, food addiction course is going on. Also, Dr. Tarman, and we have a good class there. Again, I think Food Junkies book, that would be another one to go through if you haven't already seen Food Junkies. It's excellent as well. And I'm thinking more practical than scientific, but either is fine for me. All right. Do any last questions? I'll sign off. Thanks for tuning in live or watching on the replay. And until the next time, take care. Bye-bye.
If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.